Now we're going to switch over to Bill Housen, and Bill is with Signature Healthcare. He's been working with Signature Healthcare for over 10 years. The last 3 as clinical systems analyst and meaningful use specialist. Primary responsibilities include coordinating meaningful use for both eligible hospital as well as over 100 outpatient eligible professionals.
So just let me give you a quick overview of the sort of the ecosystem that we have here at Signature Healthcare. We're an integrated health system, so we have both a hospital and an ambulatory environment. For the hospital side, we're using MeHI, which you can see over there on the left, the eligible hospital there. On the ambulatory side, we're using Allscripts. Both of them are connected to the same HIS up there at the top. We use the MedAllies HIS instead of the Mass Highway for the moment. I'll come back to that more in a few minutes. And we're doing that through direct messaging for the transition to care measure. Down at the bottom of the screen there, you'll see the patient portal. We use the Follow My Health product, which has since been acquired by Allscripts, but we really wanted to have one portal there for both sides. And I'll circle back to that in a second. I just want to note that we, here at Signature Healthcare, we had both MeHI and Allscripts in place and being utilized before Meaningful Use came around, which I think made the start of our Meaningful Use journey a lot easier. We didn't really have to start from a paper-based system just to meet these requirements. We already had systems and workflows in place. We really just sort of modified those to really meet the intent for the Meaningful Use requirement there. The ambulatory patient portal went live, I think, in early 2013. I want to say March or April 2013. And the hospital joined in spring of 2014, so just earlier this year. Let's see if I can hit the next slide here. There we go. I'm going to focus specifically on the hospital side here, but this is an example of our Meaningful Use dashboard for the acute side. We ended up purchasing a third-party sort of a Meaningful Use management product. This allowed us to track each measure on this sort of a dashboard. It was much more visual than the product that came with our MeHI software that we weren't super thrilled with. It just didn't look very nice when you had to give presentations like this. So we're happy I have this dashboard to show you guys. In this snapshot, I can show you how we monitor each item. You'll notice in this example, both the view, download, transmit, and the transition to care measures are red. This would indicate that those were not being met. If I wanted to, I could click on that and drill down into it. I can see which patients are in the numerator and the denominator, which is very helpful. So especially the ambulatory world, I can know ahead of time which patients are coming in. So I can target those patients and really make sure we promote the portal to them, try to get them on there. Makes it a lot easier to try to meet those measures. So our portal strategy, I'm going to talk about that first. Initially, we focused on our express care patients. We were trying to get a patient portal population that was easy to target. We thought during the registration process we can ask these people, are you interested in learning more about our patient portal? Yes or no, and then sort of follow up with them while they were in the room or shortly after they left the room. Initially, we were finding it hard to attract the attention of the patients during the registration process, probably because they're coming in, they're still in pain, and we haven't fixed their problem yet. They're probably not interested in hearing about what they can do after the fact. They really just want to be fixed. They want their pain medications, they want fix that broken bone, all that kind of fun stuff. So what we're starting to do now, or what we've started to do, we now have IT representatives visiting the patients either after they've been seen by the provider, oftentimes on their way out the door. So I think starting tomorrow we're going to have someone planted right outside the exit. So we're going to hit those people right as they're coming out the door, and hopefully we can garner some interest that way. We're still working on more clinician involvement. IT, we sort of view this as a transition period. We're sort of trying to transition, getting a workflow into place that the clinicians could then maybe take over. On our ambulatory side, we actually have clinician involvement. One of our practices, the physician themselves are promoting the portal to the patient, and they're one of our few practices that already meet this measure on the ambulatory world. We also have another office that did a sort of an advertising blitz for the patient portal, so all of the frontline staff were just promoting it at every point of contact with the patient, whether they're walking in the door, on the way out the door, when they room the patient. They were really just promoting that portal, and they also had a huge success with that. And they're the only other office in our group that meets that requirement at the moment. So is still sort of a continuing challenge. I think we've got 15 offices that we still have to work on. Something else I just want to mention about our portal, one of our hurdles that we're still dealing with, the HIM and legal departments require us to verify identity with a government-issued photo ID before we can let people into the portal. So for our hospital, this is a significant challenge. A lot of people didn't plan to come into the hospital when their appendix burst, so maybe they didn't bring their pocketbook or they don't have their license on them. Even though they may be interested, we're having to say we're unable to sign you up at this time. So that's something we're still trying to figure out how we can deal with. How can we let them in there with a reasonable certainty to meet our, the legal obligation that that we have. So hopefully we'll have a new strategy on that soon. The best method we have found so far is to engage maternity patients after they've given birth. And then in that case, we're able to get both the mother and the child. So we've got 2 patients now signed in into the portal, which is fantastic. And the mothers, they are just so happy about that. It's one population that we found that's been very welcoming to the patient portal by nature, I guess. Also, due to some of the adolescent-specific regulation, we currently only allow patients that are 18 and over to join on the hospital side, with the exception of the newborns. And that's really because the proxy proxy access process for the patient portal is sort of confusing. So we're trying to just focus on people we know we can easily get on the portal. The patients also really seem to like the idea of having mobile access. It's a surefire selling point. When they say, oh, I don't really have a computer, yada, yada, yada. But I see that you have a smartphone in your pocket. Did you know you could do it right from the smartphone in your hand? You don't even have to be on the computer. You can request your medication refills and schedule appointments and referrals and all that stuff. That does seem to be a big help. In terms of the VDT, the view, download, transmit, we really only focus on the V piece, the view piece there. Although the download and transmit pieces are available and they're functional for the patient, the way our portal is designed, if you can access the download and transmit, you've already hit the view measure. So we're really just pushing to get them in there, and we haven't really promoted the download transmit specifically. I'm going to switch to the transition to care over here for a second. So we're using a third-party product to create our CCDAs, even though we have the Meditech system in place. We purchased a third-party product to create the CCDA. We really liked this product from Iatric, actually, because it allowed us to completely automate the process. There was very little staff workflow changes we had to do for the end user there, which of course they really like. It's less clicking for them. However, until we're on the mass highway, we're still sort of limited in who we can actually transmit those messages to. Currently, we can really only transmit to patients that fall under our umbrella, under our Signature Healthcare umbrella, which is very unfortunate because it'll be really, really helpful and much more exciting when we're able to transmit to anyone else in the state. I'm hoping that will come soon. Let's see, but that's more of a vendor sort of limitation at the moment. Some of the other considerations that we had, we initially wanted to connect directly to the mass highway for both inpatient and outpatient. We wanted to bypass any other HIS. But again, due to those vendor limitations that were outside of our control, we made the decision to connect both the Meditech and the Allscripts systems into this third-party HIS, the MedAllies HIS. That allows us to at least transmit messages within our network. It seemed better for their care continuum since most of our patients, or a significant percentage of them, stay within our own network. So it didn't make sense to, sort of silo off our ambulatory practice where, we could now not send those messages from the hospital to the ambulatory world, after a patient's discharged, let's say from the emergency room. That was again seen that as was bad for the continuum of care. Excuse me, I lost my place. We briefly considered using the Meditech built-in portal for the inpatient side. Would have been much easier from a technical implementation standpoint, but ultimately we decided we wanted one seamless portal for our patients. Plus, we had already gone live with the outpatient portal. We were really afraid that if we had more than one portal within our own network, that we would almost be competing for our own patients within our own network. Well, I know that you already saw, you're already on the Signature Healthcare ambulatory portal, but now we want you on the Signature Healthcare inpatient portal. It just didn't seem to make sense. So it's more of a technical challenge for us to implement non-vendor compatible systems. But the vendors have been very willing to work with us on that, so that was very encouraging. Some of our longer-term plans are definitely to get on the Mass Highway. We want everyone to be able to send messages to us, and we would love to be able to send messages outbound to other providers. Currently, we're still doing that paper, mail, and fax. We already in it. The unfortunate thing is we have the Mass Highway land box. We have it in our facility and ready to go. We're just not utilizing it, with the exception of the public health measures there, like immunization registry. This is very unfortunate. We're also looking at engaging some outside expertise to assist us with a full EHR optimization. We want to make sure that we're really utilizing the systems that we have efficiently and effectively while still meeting the meaningful use measures. And myself, I'm constantly looking at those stage 3 proposals and revisions to see what else is coming down the pipeline here. I really don't want any more last-minute surprises from CMS. Those are just not as fun as you might think they are.